Hi everyone, welcome to Follow Your Heart here on the Natural Parent Magazine. I'm Ann Cullen and today I'm talking about breastfeeding, specifically about how long you should be breastfeeding on each side or for each feed. Now, the first thing you need to pay attention to is and learn about is what does good drinking look like? What is it like when your baby is actively feeding? So it does no good to consider how long a baby should be on the breast if you don't know what they're doing when they're there. So if you're really unsure about what that good drinking looks like, then you can find some videos online, ask a professional to watch. What I often have my clients do is send me videos when they think the baby is drinking well, so I can say either yes or no. So make sure you're understanding that. Then what we want to consider next is looking at things like weight gains and the nappies, what's coming out of baby. So are there concerns about weight gains for anyone that's working with you and your baby? Are you not getting pooey nappies for several days? You know, what's going on? And this is especially in those early weeks. It can be a bit trickier. Things slow down in the output department sometimes after about 6 weeks. So that's not always the best. But in the first 6 weeks, when you're just getting the hang of it, the nappy output is a good indicator that the right amounts are going in. The weight gains are good to take note of. You know, we're ideally looking at around 20 grams of weight gain a day. And, you know, that's just kind of a ballpark average. It doesn't have to be exactly that. So looking at things like that, we also want to consider, is your baby happy and content most of the time? Do they cry most of the time? What's their behavior like? And is it within the range of normal for the age that your baby is? So once we're considering all of those things, then we can look at, so how much time should baby be spending at the breast and how long on each side? Now, Emma Pickett has a great article in issue 36 about this as well, so make sure to check that one out. That's on sale now. And so really, some people are told that there's a specific amount of time that babies need to breastfeed for, or they've been told that they must feed on both sides each breastfeed, okay, and that we should do things to make sure that they wake up enough to offer them the other side. So there's no truth in any of that. There's no such thing as the correct amount of time a baby is breastfeeding for in any feed, and there's no set rule about how many sides or when to switch sides or any of that. So this is why, you know, firstly understanding all of what I just talked about, but then also recognizing this just takes a little bit of time to learn and to figure out. There are no set rules, so we could talk forever about what every single baby is doing, and we would notice all the variations, all the differences, not just among babies, but around the same baby in, you know, from one day to the next, from 1 week to the next, etc. So, you know, there are no rules. So if you are spending a lot of time counting the minutes or, you know, keeping track of these details, then you're really not going to be enjoying your breastfeeding journey as much as you could be. And you're probably not really paying much attention to just your baby and what they need in that moment. So sometimes we think that the longer they feed, the better off they are, or the better that feed was. So say you've got it in your head that your baby generally feeds for about 12 to 15 minutes, and one day your baby goes and has a 5-minute feed, and then you're worried. Okay, so it hasn't really helped you out. So if keeping track of how long you're feeding for is becoming time consuming, is becoming a focus for you after, any certain amount of time, I would just encourage you to let it go. And again, you want to look at what else is going on for your baby, all the things that I talked about in the beginning of the video. And as far as needing to switch sides in a feed, if your baby actively drinks and falls asleep, then you can let your baby stay asleep. And if you want to, when they wake up and ask to be fed again, you can swap to the other side. There's no need to work to wake your baby up and make sure that they feed on both sides. The exception to that is if there's really a struggle with weight gain or some other sort of health issue going on and your providers, whoever's working with you, is concerned. So if a baby goes to the breast and falls asleep straight away without good active drinking, we're also going to be a little bit concerned. And babies can stay asleep at the breast for 40 minutes, 60 minutes, most of the time. And that doesn't necessarily equate to good feeding either. So just because a feed is long doesn't mean it's been good. So like I say, we have to look at the whole picture, put it all together. If you're concerned, please be in touch. I'm happy to do consultations with you, have a chat over the phone, over the internet, whatever we need to do, in person if you are near me, or find somebody in your area that you trust to get some help from. And yeah, I hope you can relax a bit more about your feeding and understand things a bit better. And check out issue 36 with that article from Emma Pickett as well. Lots of good information in there. Thanks everybody. Until next time, remember to follow your heart. Bye.